Do you really need the medical intervention? That's the question. Do you really need the medical intervention? And I'm going to share with you in this video a story that happened to a close relative of mine very recently that really gives reason to pause and also reflect. Now, this video is targeted at anybody over the age of 60, but most commonly, this particular question would arise in somebody who's maybe above 70 or 80, but often I find people over the age of 60, they will say they don't want certain procedures done, they don't think that the risks outweigh the benefits, or it's not worth it when you think what the potential benefits are of any intervention down the line. So let me tell you then what happened. This relative of mine, he was having some difficulty urinating. The symptoms were not terrible, and his GP did a few tests. The prostate seemed okay, the PSA was normal. There were no other red flag signs, like there was no blood in the urine. But the GP, family practitioner, referred him for a cystoscopy procedure. That's when they go in with a camera and they look into the bladder. So that's when I accompanied my relative. Now, he's around 80 years old. He's in very good shape for his age. And I went to the appointment. To be fair, the urologist was super pleasant. Actually, my relative went in for the procedure. And when he found out that I was outside and I'm a doctor, he actually came out himself to call me in and said, you can come in as well during the procedure and I'll explain everything. Very, very good doctor, actually. So the procedure got done and my relative, unfortunately, during the procedure had a lot of discomfort. As you can imagine, it's not pleasant to have a camera put up there. And there was no lesion found, thankfully. It looked like there was something simply called a trabeculated bladder. The urologist again confirmed that the prostate seemed okay. And after the procedure, we sat down and the urologist said, well, if you want more tests done, the next test would be a urodynamics study, which is slightly, I would say, maybe a little bit more invasive in order to do that test to look at the urine flow. But the only reason to do that test would be if surgery was required. So the doctor went over the pros and cons, and the big question was, did my relative even want surgery? Were his symptoms even that bad? So anyway, we said we would think about it. But over the next couple of days, my relative, because of the cystoscopy procedure, was having a lot of pain and discomfort whenever he urinated. There was a lot of pain, and eventually, a couple of days later, we actually had to go to an urgent care facility on the weekend. Thankfully, it was open on the weekend. And he was prescribed an antibiotic, started to feel a little bit better after the antibiotic, but then actually required a local anesthetic as well, some lidocaine, just to help ease the discomfort. And I thought to myself afterwards, I thought, well, you had been referred for the cystoscopy, and fair enough, you made that decision to have the cystoscopy, but you didn't have any red flag signs beforehand. We confirmed that there was no issue with the prostate. The prostate blood test was already normal. And then if you want to go further, the urologist said that the test would be a urodynamic study, which would be done at a different time. And that would be if you were going to have surgery, maybe to help with some of your urinary symptoms. And some of the risks of that surgery, the urologist told us this, could potentially be incontinence or other risks. I mean, obviously that doesn't happen most of the time, but that was a risk. But I thought to myself, if the symptoms were not really bothering you that much before the cystoscopy, you have the cystoscopy, then you develop an infection from the cystoscopy, then you're having a lot of pain, you require more medicine afterwards. And did we really need the cystoscopy in the first place? That was going through my mind. And I think scenarios like this play out all across the Western world because as doctors, as a medical profession, we're very good at throwing procedures at people, investigations, but we often don't think, especially at a certain age, is this really necessary? Do we have to go ahead? Are we going to have to do more investigations? Does the person even want intervention down the line? Why are we doing this? Now, okay, in this circumstance, a conversation had already happened before I even got involved, and my relative decided they did want the cystoscopy, but it just makes me wonder. And I wanted to put this out there to you. What do you think? Do you think too often as a medical profession, we dive all in and we don't really think about the consequences and whether the benefits outweigh the risks? And what are the benefits anyway of doing this procedure? Was there a strong indication in the first place? And then he suffered for several days afterwards as a result of the procedure. And so do let me know down below. I think these discussions are very important to have. Take care, everyone. Stay strong, keep going. I hope you are all managing to stay healthy as naturally as possible. Your success is my success. Check in the links down below for my website, all the other work I do, and my MetThrive method, insulin resistance reversal, and holistic natural fat loss program. Also, our natural health and well-being store, ohighwellness.com if you're in the USA, North America, ohighwellness.co if you're in the UK, Europe. If you enjoyed this video, you will also enjoy some of my other videos on how we can improve our healthcare system. Hit the like button if you like this video, the subscribe button for more similar videos in the future. Do share with anyone else who may enjoy watching this, and we will speak again in the next video.